Hi, everyone. Thanks for joining us for this event. I'm Cecilia Dominici, and I'll be guiding our talk today. So we're going to be talking about something that's really interesting and relevant right now. How AI is being used in social media for health and how we balance all the new possibilities with the need to keep people stressed. It's a bit of a hot topic, but for good reason. AI is changing so much about how we communicate online, including about health, and that brings both opportunities and challenges. I'm really pleased to have Matteo Berlucchi with us today. Matteo is the CEO and co-founder of Healthily, a company that's using AI in healthcare. He's got tons of experience in digital health and is right at the forefront of using AI in this field. We'll be talking about how AI is shaking things up in health communication and social media, what kind of problems that might cause, and how we can keep innovating while making sure people still trust what they're saying. Hi, Matteo. It's great to have you here.
Hi, Cecilia. It's great to be here. Nice to see you.
Nice to see you again. So, are you ready to dive into these topics?
Always very happy to talk about these topics. Very, very relevant, very interesting.
Brilliant. Okay. The first topic that I want to talk about is how AI could change the way we talk about health on social media. Some people think it could really improve how patients get health information and even spot health trends early. But then other people are wondering if it's just hype, essentially. So I wanted to ask you, from your work, what do you see as the most important ways AI is actually changing health communication on social media right now? And then looking at the future, what new developments do you think will make the biggest difference in the next few years?
Well, it's a tricky question because health information is a very peculiar thing. And the problem with health information, I think, we've been working on this with Healthily for over 10 years now, is that the information is out there. The problem is, how do you find the relevant information for you? And because we're all different, we all have different DNAs, we have different histories, we have different environments, we have different medical histories. And so the real unique things about health information is that while it's all there and it's available somewhere, is how do you find the right piece of information? The problem with that is obviously that Google doesn't give you personalized information, because if you go on Google, you find the most common information or the most searched. And so you get a very generic answer. And this is what we've done. We've helpfully worked with AI to try to personalize the information. On social media, I think it's probably even worse than Google, because social media is the personalization that we see today in social media. It's not so much on the content, but it's on the targeting of the content. So what you see in your infinite scroll on Instagram or Facebook is dictated by what you've been seeing before. So what social media is being used to spread things that obviously have a commercial angle, because unfortunately the kind of meaningful things that don't have a commercial angle don't really take off on social media. And these things, these kind of topics are generally generic. So you have somebody promoting the latest diet, and that diet might be completely wrong for you, but there's no obviously targeting based on your situation to check whether that diet would be relevant for you or not. So I think that you're seeing that in social media is being used, not, and to be honest, not so much with the AI, because while the AI could be very relevant to particular user profiles, because social media is very rich, there's a lot of data. So the social media networks know a lot about you. So they could potentially target you the relevant things. But I don't think the content is sophisticated enough yet to be targeted to you. And even if it was sophisticated enough, there's no filter that checks whether the information that is given to you is medically validated. So, I could come up with a new diet called the Matteo diet, which is, I don't know, drink a lot of wine and, and a lot of, I don't know, pineapples, and just claim that it's great to, cure diabetes type 1, and just target people that, I can detect from a social network that have diabetes type 1. And there's really no control on that at all. So there's definitely a danger. I am luckily, I don't think we got to the point yet where the AI is producing personalized content, but we know it's possible because with things like ChatGPT, you can produce content at mass scale and you can make it very targeted. So I haven't seen anything like that yet, but it's definitely possible. And so, how do you protect yourself from that is very difficult because, I don't think the filters and the processes are in place to protect people from exposure to the wrong type of health information, not just on social media, also on Google.
That's really interesting, actually. It almost like feels like we're not seeing yet like significant changes in many ways, but we're on the brink of it. And what you said about Google really resonated with me because it made me think of the sort of old joke that I heard that if you Google diseases, essentially it just tells you which diseases got the best SEO, not really the
Exactly.
most relevant, which is really funny. So maybe
Yeah.
that's the situation right now, but it's definitely evolving. Thank you for that. So definitely a lot of concerns that people kind of like have about this stuff, even though we haven't kind of see like that, we haven't seen them play out just yet. But I kind of wanted to kind of deep dive on that and think a little bit about what kind of people are worried about in terms of like data concerns and maybe ethical considerations, right? So we know kind of like we hear a lot in our sector that people are already worried about their personal data, like and false information online, especially when it comes to health, right? So kind of like something I've been hearing in that some people like are a bit worried that actually AI might make the problem worse, maybe by like misusing health data or actually spreading incorrect health advice. So we were saying, right, when and there is personalized content, like how is that, then verified? So how would you respond to these worries? Like, what are the main ethical issues that you faced, like, healthily, and kind of how are you guys at the moment trying to tackle them and kind of be on the front foot of what might happen?
It is definitely an issue, and my experience was kind of a little bit disappointing. Is that while people seem to express concerns about the use of their data in surveys, they don't seem to behave accordingly. Because if you think of how people use the internet, me included, you don't spend too much time thinking about, just for example, cookies. You just accept the cookies and you just really don't go and read what are the cookies going to be used for. So I've seen also in our experience that, while people say when they're asked, are you worried about using it? They say, oh yeah, I'm very worried. But in reality, they don't do much about it in terms of their behavior. So as a consequence of that, a lot of companies, especially the big, the big players, the incumbents, the Google, the Apple, Facebook, and so on, they are in a position where they can harvest a huge amount of personal health data, which albeit being regulated in theory from, there's a HIPAA in the United States, which is the regular, how data should be, transferred between different players, and GDPR in Europe. Who knows what they're doing with this data? And, if you think about the Apple Watch knows when you're sleeping, when you're getting excited, because you can see your heart rate going up, and they know exactly who you are. And what are they doing with the data? Only Apple knows. But I don't think that people that have an Apple iWatch particularly worry about this. Otherwise they would have not bought the watch in the first place. So I think that unfortunately this kind of point of the trust and the risks fall squarely with the company, not with the users. And so, for example, at Healthily, what we decided to do from the outset was to use a principle which I always found very clever, which is called the principle of data minimization, where basically you behave in such a way that you only collect the data that you actually need to deliver the service. You don't ask for anything more than you actually need. So with Healthily, we give people with AI personalized recommendations. For example, we don't need to know their date of birth. We just need to know how old they are. So we ask which year you were born, and I just need to know you're born in, 1992. It's enough. I don't need to know you're born on the 6th of April. And that piece of data is very important because it can be used to identify you. So I think the companies have to behave. There's going to be fines for sure coming our way. There'll be some big, scandals, and we've seen them in the past, even in other sectors, not healthcare. And and at the end of the day, people are easily fooled. And as I think a philosopher used to say, the easiest person to fool is yourself, because you fool yourself all the time. So people don't really spend enough thinking about this data. Maybe you need more education, but I think there's a big knowledge and awareness gap there, and I'm not sure what's the quick fix for that.
Yeah, that's really interesting actually about the knowledge gap, because I think there is so many buzzwords. I feel like more than ever, right? We're not strangers to this in our industry, but especially around AI, often even like I have to ask other people, okay, but what do you mean when you're talking
Mm.
about, certain concerns or certain kind of like claims? What kind of AI you're talking about? What kind of application you're talking about? Because often it's just really unclear. So yeah, I definitely agree with you on the knowledge gap, like both I think in sort of the professional field and with the public. And I hope that we can help people a lot with that as well. Also explaining about, how to, sort of, for example, like spot, content that might be concerning or things like that. That's my hope anyway. But you gave me a nice segue with the GDPR and IPA actually, because that's the next topic I wanted to bring up is another hot topic, obviously, which is all about innovation, but also then regulation and trust, right? Which I feel like it kind of is the evolution of, as you said, like data protection and the themes that we just discussed. So obviously that's kind of I think the next sort of scandal maybe waiting to happen, as you said, but also like that's the next, I suppose, concern in the sector, right? So some people are saying we need really strict rules about how to protect the public, and then other people or the professionals in the field might think, okay, we don't need too many rules because that is going to stifle innovation and progress. And that's kind of like, I think, a debate that is not even necessarily about AI. It's a bit of an old age-old
Yeah.
debate in technology and innovation. And, it is kind of like something that happens cyclically, probably, right? So, and then it's interesting when you said about companies taking responsibility, because I do feel that that's the other part of the equation. Like companies need to self-regulate and actually build their trust proactively, even before the regulation. So, kind of what's your take on this? Kind of like what's the balance between kind of encouraging innovation in AI, but then also fostering that public trust where maybe the public doesn't know too much about it? What is the role that a company like yours, like Healthily, should play in this? And kind of like, what do you think is going to happen with the regulation about AI in healthcare? Have you got any predictions on that?
Predictions, and I'm doing predictions that never turn out right anyway. No, it's a huge topic, and especially I think it's a global geopolitical topic, because the approach to safety and trust changes by country. Essentially, if you look at the United States, Europe, and the Far East and China, those countries, there's a completely different approach. And that creates, unfortunately, an uneven competitive landscape. Because if you're in China, you're allowed to develop technologies that in Europe would not be allowed, and that could potentially put Chinese, companies ahead technically, because they have less restrictions, clearly. I don't know, it's again, I think it's a cultural point. I think that trust is important, but there's real trust and perceived trust. There is the trust that people manage to project. You feel like the trustworthy companies, and then, until something comes up to prove that they're not, people trust them, even if they were in reality not behaving in a trustworthy way. So it's very, very difficult. And at Healthily, what we've done, because we're not Google or Apple, obviously being a smaller player, you have to make sure you build a very solid trust foundation. JP Morgan, the famous banker, used to say, you can lose your money many times over, but you can only lose trust once. And so it's really important that you put safety and trust and transparency and sort of following the rules at the core of your technology innovation development. It has a cost. because you develop in a slower way because you have more, things to think about. But in theory, and hopefully further down the line, longer term, you should have, innovation that is more robust and is more trustworthy, but with real trust. Innovation that when you open under the bonnet, you don't find some very scary things, which, I wouldn't put my hand on heart on lots of companies that we think are trustworthy to see what they actually do. So again, it goes back to your nature, your culture. I think leadership in a company is very important. These kind of things come from the top. If you have founders, CEOs that put this at the center of our strategy, then you'll find the company adopts these protocols and approach. And then you might have some CEOs that want to build a unicorn very fast and they don't really care and they cut all the corners that they can. So, it's an AI is making everything even more complicated because AI, besides what it does, what's happening with AI is that there is a race. There is clearly, or there is a feeling that everybody needs to rush. Which again, I'm old enough to remember the bubble in the dot-com period in 1998, 99, where everybody was rushing to internet, we need to build, e-commerce and that created a carnage, obviously. A lot of bad things happen. And I have the feeling that with AI, it's a little bit similar. People are just trying to put their kind of the AI feather in their hat in any way. And you saw OpenAI achieving this incredible valuation just a few days ago, $157 billion, and it makes you wonder how sustainable this is. Are the valuations of these companies correct? Where is this all going? And there's no doubt that AI is here to stay and is going to change many, many things. And it will pose a lot of these trust and ethical questions because AI is a very complex technology. Going back to the knowledge gap from the beginning, AI has an even bigger knowledge gap compared to just building a website that people can get their head around, building a large language model or something with generative AI. Even the people that are developing, sometimes they're surprised with what this technology can do. They go like, well, we didn't code it to do that, but it's actually doing it. So they didn't even know themselves. So it's quite concerning. Can you fix all of this with regulation? I don't think so. It's not practical. It's not, it doesn't help business, but some level of control and regulation is helpful, provided that, as you said, it doesn't choke too much innovation.
Yeah, that's really interesting. Thank you. It's really kind of made me think, as you say, like we have these learnings from the past, right? And it's interesting how these things come up again and again, because it's like, as you rightly say, the incredible valuation OpenAI just had immediately made me think, okay, but what's the commercial model? And something that then I thought about is that other, profound changes in society we've had recently in the last 10, 15 years was, companies that build very fast and then figured out the commercial model later. And then at that point, it was kind of almost unclear what kind of company they were. I mean, it happened with Facebook,
Yeah.
For ages, they said, we're not an editorial company, we're not a media company, we cannot be regulated. But obviously, very obviously, the commercial model became that of essentially advertising and media. And then we've had it a lot with kind of VC, direct to consumer, so venture capital backed companies like, the sort of Deliveroo and, Uber, and actually how that had profound effects on society, once actually the commercialization had come into play and, they eliminated the competition. So yeah, you're right. I think it's so difficult to regulate. You don't want to like start innovation, and then equally, it does go back for me to values a lot. What are the values of these companies and how maybe we can kind of encourage that kind of innovation. Yeah.
Totally.
Well, thank you so much. This has been a really illuminating and interesting chat. So it's been really, I mean, we talked about a lot of things in a very short period of time. I feel like we've touched on some really, really big stuff, right? So yeah, it's been really interesting. Thanks so much, Matteo. And for me, our chat really made me think about kind of like the big takeaway being, that it's really important that we figure out how to use tech for the public good, right? It's more important than ever that we do this because balancing innovation and trust is not something that just happens casually, randomly, but actually we have to kind of make it happen. We have to be very deliberate. And it's probably going to require a lot of collaboration. That's my reflection as a sort of closing thought to our chat, right? We have to be working together, like everyone is like in the sector, like the tech companies, the public and private healthcare providers, like the policymakers, the public themselves, and help the public understand. And, I like what you said about developing in the right way, because I think developing responsibly is going to be so important, and being transparent and keep talking about these issues essentially, and being really honest about what's going on. So no, thank you so much for our chat. That was really, really interesting.
It's a pleasure. It's a pleasure. If I give you my closing thought is that the biggest, so the elephant in the room for all technologies, but AI in particular, and when it comes to healthcare, which is the space I work in, is that the challenge at the end of the day is finding the right balance between the commercial objectives and doing things in the right way. And that's the tension, because the commercial directives and the commercial imperatives, as you said before, with, Deliveroo, at the end of the day is what drives everything. And so how do you balance between the commercial imperatives and the trust, the safety, doing the good things and the right things? And that's where I think if we can, as collectively, strike the right balance, then that's the sweet spot. But it's very hard because the commercial and the other side, they don't like each other very much. They tend they compete. So that's the crux of it, I think.
Very well said. Thank you so much.
Thank you,
And
Cecilia.
oh, thanks. And I also wanted to say a big thank you to FPA for setting this up. So I feel like they're doing such important work and getting us to talk about these big themes about innovation in public services, including healthcare. So thanks to the team, and thanks to everyone watching. I hope that you found this chat interesting. I hope that you found it stimulating and got you thinking about some new things. And thanks for listening in, everyone. And I hope you have a great rest of your day.
Thank you, everyone.